know I'm an athletic therapist, and bet you didn't realize this, but I don't just work out, okay? My profession is a part of the sports medicine model, and we work hard with everyone to get things going. So for those of you who have no clue what I do, when I have a patient coming in, or an athlete on the field, whatever, before you even got to me, I have observed you. I'm looking, I'm paying attention. How do you move? How you function? How you sit, stand, walk? Okay? When I get my patients in my office, I get the history from them. So they're telling me what's going on, where their pain is, give me past histories and things, and just trying to figure out and filter from all the information that they're giving me so I can make my differential diagnosis on what it potentially is. So then I officially do I get the person to stand, and I'm going to observe what is asymmetrical. So what's not balanced on your body? Where is there shading or valleys? What looks off or weird, or what doesn't look balanced, right? So I'm going to have you stand straight on so I can see you this way. I'm going to get you to stand so I can see your back, okay? Side and the other side. The reason for that is I want to see what is different, or what shifts, or what moves, and how can you actually move that way. All right, so after that, if I didn't pay attention earlier to how you walk, I'll get you walk, and that's your gait, okay? So I'm going to see, are you walking normal, or are you walking with a swagger? Are you swaying, right? Are you limping, right? Do you walk with your feet out? There are people that do that. I had a patient that they would walk and they would kind of clear their foot because they were in a walking boot, and that was how they had to walk and move for the longest while. So all of those things are super important, okay? Next part is we clear the joint. So get you to do some functional movements just to make sure other structures aren't affected, and that it's just the area that you're coming in that you're kind of concerned about, okay? So after I've done that, then we're gonna do active range of motion, passive range of motion, isometric resisted muscle testing, and special tests. So with active range of motion, I just wanna see how you move, okay? It's gonna show me which muscles are activating, which ones aren't, okay? Which ones are weak or struggling, okay? And whether you're cheating or not. Passive range of motion, and this is a struggle as a therapist, and as a physician too, right? There'll be a lot of times when we're trying to do passive range of motion and people think, oh, I gotta move this, don't help us, don't, okay? And the reason for that is passive range of motion is testing your ligaments. So you don't really have control over that. So you should just be limp so we can just move you, okay? Because we're just checking to make sure the integrity of those structures are still intact. So if your muscle, like if you're activating the muscle and contracting it, that's not gonna help us. And I know sometimes you're really stressed out and like things are just so tense, and that's where we just need you to relax and chill out so that we can get a better assessment of what's going on and help you out. Because the more you fight it, and not that you're doing it on purpose, the more difficult it makes it for the person assessing of how to help you out, right? So then after we've done the passive range of motion, we go into isometric resisted muscle testing. So we're gonna test your strength, okay? It's a gauge from 0 to 5, and we are going to test you in different ranges to see, are you cheating? Do you have full strength? Can you lift? Can you move? Can you do this? Can you meet this? Can you activate this? And if you can't, that's gonna also help us to filter down and figure out, okay, it's this, this, or this, okay. And then the last part is we're gonna do special tests. So if we have these potential, A, B, C, okay, so we have this, this, and this, what could it be? We'll do our special tests to confirm on our differential diagnosis what is the potential injury that's going on. And then afterwards, we're just gonna palpate. And that's just a fancy word to say we're going to touch the area, okay? So we're gonna palpate, we're not gonna rub you, we're gonna palpate, okay? With one hand, not two, because it's get confusing and you won't be able to identify anything if we ask you questions. So you're gonna palpate and see, okay, oh, this feels tense there, okay. So just again, so everything we do in our assessment is to figure out how best to help you and what's the root cause so we can address the structures, okay? So that's just the first part of my job. The other parts are the pain management. We're going to address structures. We're going to get things stabilized. Then we're going to move into our injury rehab, and we're going to work you from being in a controlled environment to an unstable environment. So some like outside in the field or wherever you need to be for competition or whatever. And we are going to try our hardest to transition you from being in the clinic to in the field, and there not be a difference. So we have psychological components, we have balance, proprioception, we have strength, endurance, stability, speed, agility, quickness, biomechanics. There's so many things that we have to do to make sure you can get from being in the clinic, working with the therapist, to running on the football field or on the ice and not having a worry in the world that, you know, that injury is going to happen, you're going to hurt yourself or anything like that. So if we've done a good enough job, you should be able to go from, I've got pain, we're stabilized the pain, we've taught you how to, we've educated you, we've gotten your body comfortable and confident and moving on, that you transition all the way to you've returned to play and there is no worry or concern because you can be confident and take care of yourself. And that is how the whole thing works. So that is my job in quite the rant there. So hopefully you guys learned something. Yeah, that's what I do. And that's why my job's awesome, because I can help so many people to feel limitless and feel so much better about themselves. And yeah, share this video, guys. Let people know there are easier ways and less stressful ways to take care of your body, but you gotta find the right individuals to help you out with that, okay? All right, best of luck. Bye, guys.